Hey, good evening, YouTubers. Hope everything's going well with you guys out there. My name's Lee, and I'm here to talk to you guys about my fight with throat cancer I had. When I started looking on YouTube for information about throat cancer, found a lot of information, but most of it was from doctors and hospitals and medical universities, and I found a lot of that stuff is just a lot harder to understand than it really needed to be for me anyway. I'm not a medical student. I'm not a doctor. Regular person who just happened to come down and catch a dose of the throat cancer there. Um, Sorry, I didn't hear the cat. Anyway, so hopefully as we go through this thing, there'll be some information that you'll find useful that you can use in your own battle if you're a patient, if you're a throat cancer patient, you've been recently diagnosed or you were diagnosed a while back, you're going through treatment, or you're a family member of somebody who has been diagnosed with throat cancer or is going through treatment, or a friend of somebody who has been diagnosed and going through treatment with throat cancer, even through recovery. There's a lot of questions I had, and while the doctors did a really good job answering my questions, there was a lot of things I didn't know. I didn't know. I know that sounds stupid, but if you don't know the question to ask, then you don't know what you don't know. And so a lot of things I didn't know the questions to ask until it was late. And then I was asking a question which probably would have been good to know prior to the event, prior to what was happening. Um, it is a tougher fight than I anticipated. I did not expect what happened. I did not expect the difficulty that was going on. I was told it would be hard. I was told it would be difficult, but me being who I am, hard-headed, a bit stubborn, um, it just didn't seem that it was going to be that big a deal. And it turned out to be a much bigger deal than I thought. Um, so as we go through this, I want you guys to ask questions. Down in the comments, send me a question, send me a comment, tell me how I'm doing. Um, Very first YouTube video, so I know there's a lot of room for improvement. But I want you to definitely ask some questions, especially once we start getting into the nuts and bolts of what happened. And we're going to cover everything from pre-diagnosis to diagnosis to pre-treatment meetings to starting treatment, throughout treatment, and then the end of treatment and recovery. And, you know, for somebody who was, again, being hard-headed, I was absolutely convinced that, and when the treatment stopped, everything instantly would just start going down. No more pain, no more anguishing moments. I would be able to eat, um, be able to drink, nor everything would be normal. And that's not quite true. That is not the way it happens. I'd been warned about that, and I chose not to really pay attention to that. I chose to think very positively that, oh no, not for me. I'll be able to muscle through this. It's not going to happen. It didn't happen for me. I'm not saying it's not going to happen. It didn't happen for me. That muscling through it and, oh, you know, standing there and thumping your chest is not going to get you through the whole thing. So we're going to interview people, hopefully talk to some of the doctors involved, the nurses, family members, things like that, to kind of get some different perspectives other than just Lee's perspective, because Lee has one perspective, and then there's other people who have another perspective about it. We're going to talk to some health people, some people that are involved in my recovery right now, involved in my workout, my diet, and professionals that deal with these things, and you know, find out what their thoughts are on this as well. Again, this is not just a one-time shot. It's going to take a while. We're going to put out a bunch of different videos, hopefully keeping your interest and we're going to laugh a lot because I can't help it. Cry a little bit more than likely. And sometimes it's going to be serious, sometimes not so much. I want to have a little fun with it. It's a serious matter, but I don't want to scare you to death. And like I said, feel free to ask questions. And by the end of us going through this series, I really, really hope there's at least one, if not more, people that I'm able to reach who are diagnosed with throat cancer, going through the treatment, going through the recovery, and something I say either makes you ask a question that helps you out or makes you sit back and go, yeah, that guy Lee was able to get through this. I should be able to get through this as well. So, yeah, I can do it. And you can. And no matter how hard it seems, you can. It does end. Right now, I'm just over a year in. Starting February 3rd is when, I believe it's February 3rd, is when I had my first doctor's appointment. I had a sore throat and an earache. And here we are, 1 year, 12 days later, and I'm still in the recovery process. Certainly not where I was in September when the treatment ended, but certainly not fully recovered as well. So just to kind of let you guys know that it's going to be a long tail, and we're going to do it just a little bit at a time. Keep your interest. Keep those comments coming. Send them to me. Let's see what happens. Maybe I can find the right answers. Thanks. Have a great night. Look forward to seeing you again.